hero. It's a win-win situation because you protect yourself from dying of the disease and you protect your loved ones from dying of the disease as well. Kung meron kang kamag-anak na hindi pwede talagang mabakunahan, pues magpabakuna ka. Kasi yun lang ang tulong na mabibigay mo sa kanila. So go on your self, of the community, think of the community, think of the Philippines. Kasi kailangan magkaisa tayo. We'll have to join hands.
It was really exciting po na magbigay ng unang bakuna. Kanina nga, bago kami talaga mag-start ng vaccination, nung tiningnan ko na yung bakuna muna prior, nakaramdam ako ng excitement and happiness at nakaka-proud at the same time na finally maging start na tayo ng official rollout ng ating vaccination sa Pilipinas. Nakita naman siguro na medyo kabado rin dahil na this is the first vaccination and natural lang siguro makaramdam ng gano'n. After that, talagang hindi mo maintindihan yung nararamdaman mo. It's a mixture of emotions. Pero ang pinaka maganda doon is nakapagsimula na tayo. Marami sa atin na healthcare workers ay matagal nang lumalaban sa COVID-19. Mag-isang taon na, actually isang taon na tayo ay lumalaban dito. At panahon na para tayo ay mas lumaban palalo. Kung tayo dati ay nakikipaglaban sa pamamagitan ng pag-aalaga ng ating mga pasyente, panahon na nadagdagan natin ng proteksyon ang mga katawan natin, ang mga sarili natin. Proteksyon hindi lang para protektahan ng sarili, kundi ang ating pamilya, mga kasamahan at ang ating komunidad. So ang lahat po sana ay hinihikayat namin na magpabakuna dahil ito po ay resback natin sa labanan natin sa COVID-19.
I am Joseph and I am a nurse dito po sa Dr. Jose Rodriguez General Hospital sa San Antonio, and I have just got vaccinated for the first dose of COVID-19 vaccine for Sinovac. As of time, ang nararamdaman ko after vaccination, I feel good. Wala naman ako nararamdaman kirot o sakit or any side effect as of time. So from the past 15 minutes of monitoring, okay naman ang vital signs. Again, walang injection site pain, wala rin pamamaga. How was the process ng vaccination sa aming hospital? Based doon sa aming easy simulation as expected, nagawa naman, execute ng aming mga teams ng kanilang mga responsibilities from registration, vital signs screening, counseling, actual vaccination, and post-monitoring upon vaccination. My message po doon sa mga employees or for those people na hesitant to vaccinate.
And we encourage everybody, all our staff, our nurses, doctors, to participate in this vaccination program. Nakikita ko na maraming na-encourage to participate. Unlike nung nanghihingi na kami ng mga data sa kanila kahapon, their consent, medyo hesitant pa talaga sila. But for now, ang dami namin na-receive na mga texts and messages informing us na, yes ma'am, magpapabakuna po kami. So, we are very hopeful na ma-encourage namin all our healthcare workers in this institution, Pasay City General Hospital, to be vaccinated with the COVID-19 vaccine.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can be the solution.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Be the solution sa COVID-19!
Para safe ang pamilya, dapat sa bahay sanitation ang bida. Maging bida solusyon sa COVID-19.
Uwi sa bahay, bawal yakap at kiss. Maligo-ligo muna from head and shoulders to feet. At ang damit na yung ginamit. Detergent with bleach dapat para ang germs di kumapit sa kids. Maging malinis-linis araw-araw para safe si lolo, lola, ate, kuya. Maging malinis-linis araw-araw para you can be the solusyon. Sa kusina ay hugasan agad ang mga plato. Mas joyful ang salo-salo. Sa mga bagay iwas hawak para iwas hawak. Buong kamay ay hugasan mo na. Walang mask. Isanitize ang kamay. Dumistansya 1 metro. Alamin ang totoo. Maging malinis-linis araw-araw para sa buong pamilya, ako, ikaw. Maging malinis-linis araw-araw para you can be the solution. Isanitize ang katawan at buong bahay para you can be the solution. Simulan sa bahay. Maging malinis 'cause together we can all be the bida. Be the solusyon. Be the solusyon. Be the solusyon.
Narito na ang kasangga ng mga bida. Tara't panoorin ang unang araw ng res bakuna sa ating bansa.
The fight is already personal for me. No? We do it for the people we love that have after taken away by COVID. So the medical wise it's routine, but I think the emotions that come with it make it really very, very special for me. Pinatunayan naman nila na ito'y epektibo at ligtas at safe. I think we should just keep moving forward, take any vaccine that comes with the approval of the FDA. Do not even do it for yourself. Do it for your family, do it for your community, and do it for the country.
It was really exciting po na magbigay ng unang bakuna. Kanina nga, bago kami talaga mag-start ng vaccination, nung tiningnan ko na yung bakuna muna prior, nakaramdam ako ng excitement and happiness at nakaka-proud at the same time na finally maging start na tayo ng official rollout ng ating vaccination sa Pilipinas. Marami sa atin na healthcare workers ay matagal nang lumalaban sa COVID-19 at panahon na para tayo ay mas lumaban palalo. Panahon na nadagdagan natin ng proteksyon ang mga katawan natin, ang mga sarili natin. So ang lahat po sana, hihikayat namin na magpabakuna dahil ito po ay rest back natin sa labanan natin sa COVID-19. Magbigay ng unang bakuna. Kanina nga, bago kami talaga mag-start ng vaccination, nung tiningnan ko na yung bakuna muna prior, nakaramdam ako ng excitement and happiness at nakaka-proud at the same time na finally maging start na tayo ng official rollout ng ating vaccination sa Pilipinas. Nakita naman siguro na medyo kabado rin dahil nga this is the first vaccination and natural lang siguro makaramdam ng ganon. After that, talagang hindi mo maintindihan yung nararamdaman mo. It's a mixture of emotions, pero ang pinaka maganda doon is nakapagsimula na tayo.
Sir Gani, I have a message sa chat box sa'yo privately. Good morning, Benildian community.
Good morning, friends from the Department of Health.
Good morning, family and friends joining us this morning. Our family and friends from the La Salle College of St. Benilde and of course from the Department of Health.
We would like to thank the Department of Health for conducting this Res Bakuna Kasaganang Bayan virtual town hall on COVID-19 vaccine deployment plan with the Benildian community through the Faculty Association of Benilde. At this point, may I briefly ask the Faculty Association of Benilde board members to briefly turn on their video and just greet everybody good morning, just very briefly. Morning.
Morning.
Good morning. Yan,
Good
from
morning.
the faculty.
Good morning.
Good
morning.
Yan, thank you.
Thank you. She is Miss Veronica Solano of the Faculty Association of Benilde or FAB.
He is Architect Ferdinand de la Paz of the Faculty Association of Benilde, and we will be your host this morning.
Before we start our town hall meeting, let us first acknowledge the holy presence of our divine healer through a prayer, and this will be followed by the Philippine National Anthem.
Then we will have the webinar house rules followed by the rundown of activities.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Saint John Baptist de la Salle,
Pray for us.
Saint Benilde Romanson,
Pray for us.
live Jesus in our hearts
Forever.
Okay, would like to ask everyone to please register in the attendance link flashed on the screen and also posted in the Zoom chat box. Thank you.
Before we proceed to our entry poll, let me announce also that we are being watched live through our De La Salle College of St. Benilde Facebook page. So we proceed with the entry poll, and we now invite everyone to participate as we answer this question. How likely are you to get a COVID-19 vaccine if available with safety and effectiveness comparable to other common vaccines and with FDA approval for public use? We will devote a couple of minutes for you to be able to answer and log in your responses to this question. So, are you highly likely to get a COVID-19 vaccine or not likely to get a COVID-19 vaccine or not sure if I will get a COVID-19 vaccine? Please type in your responses and participate in this poll, and we will show you the results in a couple of minutes. So we now see that you are starting to type in your answers.
Sir Nandi, have you had your first dose of vaccination?
Not yet. I'm still waiting for a call. I'm actually registered. I'm registered both in my LGU and of course in our Benilde registry.
I had mine a week ago. And ayan, fortunately, ay naman.
So all you need to do, of course, is to click in or type in your answers. And in a couple of minutes, in less than a couple of minutes, we will show you the results.
Yes. Keep on voting. Okay, express your thoughts.
So we can see some significant trend here in the way you're answering, and we are happy to see that a lot of you have already typed in, but we're still giving a minute to everyone, allow everyone to be able to answer. So far, about 45 have, and increasing in number, about more than half of the audience now have responded. We're hoping that the rest could still catch up and type in. Okay, so we're actually now showing you the results. I hope you can see the results flashed on your screens or in your pop-up window. And we see here a significant number of you are highly likely to get a COVID-19 vaccine with 67%. That's a resounding 67%. And just 2% are not likely, and not sure is just a mere 11%. So later on, we will also have another poll towards the end. Thank you very much for your participation to this poll.
Okay, thanks, Sir Nandi. Now, let's start the town hall rolling. To brief us with the town hall meeting is the Division Chief of the Health Promotion Bureau of the Department of Health. Let us all welcome Ms. Maria Arlene Arbas.
Magandang araw po sa ating lahat. Mula po sa Health Promotion Bureau, sa pangunguna po ng aming Direktor, Dr. Beverly Lorraine Ho, ikinagagalak po naming maisagawa ang town hall session na ito, katuwang po ang ating mga partner organizations. Ang bakuna po ay dagdag proteksyon natin laban sa symptomatic at malubhang COVID-19. Nasuri po ito ng mga independent expert at ng ating Philippine Food and Drug Administration. Sa town hall session po ngayong araw na ito, makakasama po natin ang iba't ibang eksperto upang magbigay ng kaalaman at tumugon po sa inyong mga tanong at alinlangan. Sana po sa pamamagitan ng tamang impormasyon, tayo po ay mahikayat na magpabakuna laban sa COVID-19 nang sa gayon, proteksyonan po hindi lamang po ang ating sarili, kundi ang bagkus ang ating mga mahal sa buhay. Mas matimbang po ang proteksyong na ibibigay ng COVID ng bakuna sa COVID-19 kaysa po sa risk ng side effects. Subalit, kahit po makumpleto natin ng bakuna, mas mataas po ang proteksyon kung patuloy po nating susundin ang ating mga bida behaviors. Ito po yung madalas na paghuhugas ng kamay, pagsusuot ng face mask at face shield sa lahat ng pagkakataon, pag-iwas po sa kulob at mataong lugar, at ganin din po ang pagdistansya ng 1 metro. Kung patuloy po nating susundin ang mga bida behaviors na ito, mapapababa po natin ang kaso ng COVID-19 at malilimitahan po natin ang tsansa na mag-mutate o magbagong anyo po ang virus. At ganun din po, mapapanatili po natin o hindi po maaapektuhan ang bisa ng bakuna. Tandaan po natin, ang Bida Solution Plus, ang mabisa panlaban sa kahit anong variant ng COVID-19. Sana po, ito po ang maging simula ng patuloy nating pag-uusap at pagtutulungan upang mapalagana po ang tamang impormasyon sa bakuna sa COVID-19. Ugaliin po nating mag-verify ng information sa mga tamang eksperto at sa Department of Health. Sa verified information, tayo po ay magagabayan sa tamang pagtugon sa COVID-19. Lahat po tayo ay may papel na dapat gampanan sa labang ito. Tayo ang solusyon sa COVID-19. Maraming salamat po.
Thank you very much, Ms. Arbas. Now, for the welcome remarks, let us listen to our Honorable Secretary of the Department of Health, Secretary Francisco Duque III.
Isang malusog na araw sa ating lahat. Napakalayo na ng narating natin sa pagkontra sa COVID-19. Ang pagdating ng mga bakuna sa ating bansa ay hudyat ng bagong yugto ng ating laban at bago natin pag-asa tungo sa tuluyang pagsupil ng pandemya. Ngunit sa kabila nito, isa pang dagdag na hamon na kailangan natin pagtagumpayan ay ang pagkakaroon ng mga variants at mutation sa bansa. Habang nagsisimula ang ating pambansang pagbabakuna laban sa COVID-19, kinakailangan natin ipaalala sa ating kapwa ang halaga ng wastong pagsunod sa ating Minimum Public Health Standards or MPHS. Epektibo ang ating MPHS laban sa pagkalat ng anumang variant o mutation ng COVID-19. Nararapat lamang na idiin natin na hindi sapat ang basta-bastang pagsunod dito. Ang ating paggamit ng face mask, full coverage face shields, physical distancing, at paghugas ng kamay ay dapat natin ginagawa ng tama at maayos. Sa makatuwid, narito tayo ngayon upang ihanay ang ating kilos tungo sa pagtatagumpay ng ating pambansang pagbabakuna laban po sa COVID-19. Sa kabila ng ating patuloy sa pagresponde sa COVID-19 ay patuloy din ang ating pagsulong sa universal healthcare. Layunin ng Universal Healthcare Law ang isang Pilipinas kung saan ang bawat Pilipino ay malusog at nakakaabot ng dekalidad na serbisyong pangkalusugan. Sa pagpapatupad ng mga pangako ng UHC, napakahalaga ng bahaging ginagampanan ng mga bakuna. Lahat ng lingkod bayan sa DOH at sa buong vaccine cluster ay nananawagan sa lahat ng naririto na maging kampyon para sa ating mga bakuna. Nakasalalay sa tagumpay ng bakuna laban sa COVID-19 ang tiwala ng ating mamamayan sa halaga ng bakuna bilang instrumento ng pagpapanatili ng magandang antas na pampublikong kalusugan. Sa ating pagiging kampyon para sa bakuna laban sa COVID-19, lubos natin matitiyak ang proteksyon at kaligtasan ng ating mga kababayan. Sa bagong yugto ng ating laban sa pandemya, pag-usayin natin ang ating pagkilos upang pangalagaan ang bawat isa. Sama-sama tayong maging kampyon ng bakuna. Sama-sama natin tahakin ang landas tungo sa isang umagang nasupil na ang peligro ng pandemya. Maraming salamat at mabuhay tayong lahat.
Thank you, Secretary Duque. We pray for your good health always. Now we have been hearing and reading in the news about the various vaccine brands, but are we really familiar with each of them? Do we really know their platforms? Let us now be injected with more knowledge on the COVID-19 vaccines and other matters to help wipe away our anxiety on receiving the vaccines.
Here to discuss the vaccine, the variant, and the herd immunity, we would be hearing from the medical specialist 4 and head of public health unit of the San Lazaro Hospital. Please welcome Dr. Nympha Putong.
Ma'am, naka-mute po kayo. Dr. Nympha.
Again, good morning, everyone. Good morning to thank you for another town hall meeting, this time for De La Salle University. It is indeed an opportunity and a privilege to be an advocate to enlighten our people regarding this COVID-19 vaccine. This is actually our fight against COVID-19 pandemic. And this is our way to lessen the fears and confusion brought about by many disinformation and misinformation. So my indulgence to turn off my camera. Our mission is to increase the uptake and demand for the upcoming vaccines. We want to increase the vaccine confidence and we want to decrease vaccine hesitancy. Our scope will be as follows. We'll give background, and then we'll discuss about the new variants, the COVID-19 vaccines, herd immunity, and I will share with you our first vaccine rollout in San Lazaro Hospital that happened on March 3, 2021. So according to one of our infectious disease experts, Dr. Alora, during the 50 or the Gold Convention, which happened last year, she said that if anything would threaten the world to extinction, it would be an infectious agent. Remember that 100 years ago, the Spanish flu pandemic that happened in 1918 to 1918 is the deadliest in the history. And this infected 1/3 of the global population and killed an estimate of up to 50 million. So this is a chart of deaths by age. Notice here that the Spanish flu pandemic has a W shape, wherein the hardest hit were the young adults at the age 25 to 34. And this is because of the cytokine storm. Because this is a novel virus, the immune system then overreacted. Okay, so the most number of deaths were the healthy and the young adults. Comparing it to the usual pandemic, no, which is U-shaped, wherein the most affected were the extremes of age, the very young and the very old. And this is because of the secondary pneumonia infection among the immunocompromised people. And right now, during the COVID-19 pandemic, we have this unusual L-shape, no? Wherein the distribution is mostly among individuals over 55 years old. This is the case fatality rate by age and by sex. In a study conducted last year, both in China in blue and in light blue in Italy, there are higher mortality among elderly, among ages more than 80 years old, followed by 70 to 79, 60 to 69. And this is because of as the person grows older, the immune system gets weaker. And so these people have no ability or lesser chance to produce antibody to kill this virus. Okay. And comparing by sex, Male mortality has 1.5 times higher chance of dying compared to female mortality. And this study also showed that males have higher smoking rates in both China and the Italy. Males also are more likely to have comorbid conditions contributing to complications with COVID-19. This is the case fatality or mortality by comorbidity in China. Take note that the deadliest disease with, due to COVID-19, no, with COVID-19, no, is the cardiovascular disease. Examples are heart, heart attack, no, and stroke. This is followed by diabetes. Especially among us Filipinos po, di ba? Ang hilig nating kumain and this is our way of bonding, eating. So, the more we eat, no, lalo na yung mga sweet food natin po naman, ang pagkain po natin kadalasan matatamis, no? So, we are more prone to diabetes and also carbohydrate-rich food. Next is the chronic respiratory disease, and this includes asthma. And those, I've noticed that in our hospitals, sa Lazaro hospitals, yung mga chain smokers po na nagkaroon ng COVID-19, ito po yung mas mataas yung nang namatay. And then followed by hypertension and cancer. So among those that were admitted in New York, no, with the COVID-19, among 5,700 cases, the more than the median number of comorbidities at admission is 4 comorbidities. And in more than 88%, there is one comorbid illness. For the specific comorbidities, the most common in more than half of the cases is hypertension, followed by obesity and diabetes. Therefore po, those with may mga senior citizens ages 60 and above, no, but studies are seeing na 55 pataas ang mataas ang chances of death. Those who are males and those with comorbidities, particularly po yung mga hypertension, obesity, and diabetes, these are the ones that are higher risk of getting COVID-19 and dying of COVID. So ito po yung ina-advise po sana natin na magpabakuna na po because these are the group of people who have higher chance of dying. Again, to re-emphasize, there is significantly increased risk of mortality among seniors, among males, and among those with chronic comorbidities. Again, the most common comorbidities po, di ba? Yung mga hypertension, diabetes, obesity. Doon sa mga namatay, kadalasan po yung mga most common comorbidities, cardiovascular disease, diabetes, yung may COPD. You will notice po na nagkaroon tayo ng surge because of the appearance of the different variants, no? And there is a triple increase in the number of mortalities in NCR. So you will see here yung trend po of the increasing number of total deaths. And according to Octa team, large proportion of deaths are senior citizens. Therefore, this group is urging our government to prioritize the elderly. And ito po, I'd like to share with you a picture of my tita who is presently admitted in San Lazaro Hospital. So she's 77 years old with asthma and overweight po siya with heart disease and diabetes and hypertension. So for tomorrow, naka-schedule na po siya for tracheostomy. No? Again, red flag po natin. If you have a senior citizen, 60 years old pataas, and nagkaroon na po ng lagnat, fever, or a change in sensorium, these are red flags po. Wag na po nating i-manage sa bahay. It is advised that be brought to a hospital because if this is a COVID-19, then they are more prone to complications, they are more prone of dying. So for seniors to be given priority sa healthcare access, kahit po mild COVID pa lang po yan. the senior citizens and also those with comorbidities are advised to go to the hospital for investigation and much more admission. For seniors who have not yet applied for vaccination, to strongly reconsider getting inoculated. Kadalasan po sinasabi po ng mga seniors na nakakausap ko before, kaya ayaw daw po nilang magpabakuna, natatakot sila kasi matanda na sila. But they are more prone of COVID-19. When they get COVID-19, they are of higher chances ng getting ng complications and dying. And for those in the vulnerable sectors, ito po yung mga hindi lang po senior citizens, kundi yung mga persons with disability, no, and also yung mga pregnant women to strictly follow the public health protocols to avoid infection. So these are the 3 C's for COVID-19. We have to remember first yung closed spaces with insufficient ventilation. For example, riding an elevator. Kung kayo naman po ay able, can walk upstairs, no, mas maganda po iyon than riding an enclosed space with insufficient ventilation. Second, crowded conditions with people. So yung mga SAP po na iyan na mabinibigay po, dapat it should not be given in an enclosed space. Otherwise, it will create a super spreading event. Third is conversation in short distance po. Right now, with the technology, we have to use the power of technology when communicating. We have to keep our distance 3 feet away at least from the another person. Why? Because the reservoir or the carriers of this virus are humans. Tao po ang nagdadala po ng virus na ito. And they are asymptomatic carriers in around 40 to 60% of the cases. And everyone is a suspect case until proven otherwise. So what are our health protocols? These are the 3 W's. Wash your hands, watch your distance, and according to meta-analysis, among these health protocols, the one that is associated with the most protection is watching your distance or keeping yourself at least a meter away from another person, and followed by wearing of mask. So this is the Philippines Genome Center Biosurveillance Report, no? Among the 752 sample sequenced nationwide. Here we are seeing the total number of cases, no? For these different variants, we have the B117 in UK, the B135 in South Africa, the P1 in Brazil, and unfortunately, nakita po ito sa Central Visayas, the P3 or the Philippine variant, which up to now is not yet considered a variant of concerns, but only a variant of interest because there is a need for more investigation, particularly by the WHO. And sabi nga po, di ba, there was a Filipina who went to Hong Kong and only there na-diagnosed that there is a UK variant na from the Philippines. March 13, another variant, ito po yung P3 na first discovered nga sa Philippines, no, when investigation was done or surveillance in Japan. So these COVID-19 variants, no, were undetected by PCR emerges already. And take note that the RT-PCR tests are not 100% accurate. Kung kaya nga po, sabi nga sa news, kailangan paghandaan ang COVID variant na hindi na-detect ng RT-PCR test. And in around 1/3 of the cases po, there is what we call a false negative. That even in the absence of RT-PCR or negative at RT-PCR, it doesn't rule out a diagnosis of COVID-19. But according to our PSMID President, Dr. Isa Alejandria, the more important indicator is the healthcare capacity utilization rate because this reflects our ability to take care of the sickest of the sick. So, ito po yung ating SARS-CoV-2. Ito po yung virus ng ating COVID-19. And you see here a lot of spike protein. And one consideration of how the mutations in this strain will impact the antigen test performance is dependent whether or not the test detects the nucleocapsid which is located inside or the spike protein. We have the UK variant, no, yung P117 po, wherein the presentation is persistent cough, fatigue, muscle aches, sore throat, and fever compared to those who have the original strain. And this is associated with an increased risk of hospitalization as well as mortality, and up to 70% more deadly compared to others. And there is already an acquired mutation that enables this UK variant to evade the immune system's hence leading to infection, just like po ng South African and the Brazilian variant. In another article, says that people who tested positive for B117 or the UK variant in a community are more likely to die within 28 days of a positive test than those with other variants. No? So, yung authors also found out that the variants is up to 90% more transmissible than the predecessor lineage, but so no clear evidence of a change in disease severity. Pero yung sabi nga po, no, nagiging significantly more deadly naman ito, no, yung previous slide po natin. No? So different efforts say different things, but here what is consistent is the increased transmissibility and it becomes more deadly. No? Okay, and it may be necessary to greatly accelerate vaccine rollout to control the epidemic. In other words, even if this vaccine is not a magic bullet, this is not the only solution, but vaccination together with the non-pharmaceutical intervention is only our way out of this pandemic. This is the potential consequences of the transmissible variants. We have here a graph that shows the new deaths from the original virus strain with a case fatality of 0.8 and transmissibility of 1.1. And here, above here is the death from a strain, from a more lethal strain that causes more deaths. However, like yung sa UK variant natin, which is more transmissible, it quickly outpaces this variant that is more lethal and the original strain because of its exponential growth. And therefore, it causes more number of deaths because it can overwhelm, or it is overwhelming the healthcare system. Let us watch this po, what is happening now in India.
The worst fears of a surging pandemic realised. This is what it looks like when infections outpace treatment capacity. With no beds or room inside the hospital, patients are left outside in an anxious wait for help. Families are getting increasingly desperate. With no beds available, this man blocks traffic in a plea to staff to find room. Some are being treated in cars, sharing the limited oxygen with patients nearby.
We are running out of oxygen. The whole country is running out of oxygen, okay? The city is, we are, everybody is, okay? So please focus on that. If oxygen runs out, there is no leeway for many patients. There is no leeway. They will die.
Exhausted frontline health staff are at breaking point. With no stretchers, some resort to wheelchairs and too often have to turn people away.
The situation right now here is really very worst, critical and out of control.
Cremations have now spilled out onto the streets and even car parks. The distressing situation has caught the attention of the world.
India is going through a very dire situation that we're trying to help in any way we can.
There's a strong feeling in India that this disaster could have and should have been avoided. Huge religious gatherings and political campaigns, which even featured the Prime Minister gloating about crowd numbers, have fueled resentment. Warnings were ignored, the damage has been done. And as the virus burns through the world's second most populous nation, modelling suggests we could still be weeks away from the peak. James Oaten, ABC News, Delhi.
So it's because of the deadly double mutant COVID-19 in India. And that's have been steadily rising, no, as critical care beds, yung medicines po, and oxygen fall out in unrelenting wave of COVID infections po. So from the UK and the double mutant virus, we now go to the South African variant. No, These variants first found in South Africa, the B1351, and Brazil or P1, seem to at least evade partially the immunity from the current vaccines and natural infection, also certain therapies. No? So yung South African variant can break through the Pfizer vaccine. And a study in Israel found Pfizer's COVID-19 vaccine to be less effective on the variant found in South Africa. And that's the reason why these mRNA vaccines po are modifying their vaccines. They are now, they go back to their first and second clinical phase trial, no, in order to modify, no, their vaccines that would cover for these variants. And they are expecting na by the end of this year, they will have their booster dose for the mRNA. So this is the spike protein, and it contains these 3 proteiners. Okay. And the antibodies from vaccinated people are distributed across a broader range of parts of the virus. No? So hindi lang po yung spike protein, also targeting na dapat yung nucleocapsid. And no single mutation has a big impact on their effectiveness, making vaccines a better bet against variants than the immunity from natural infection. So sabi nga po natin, not only the P1, not only the South African, but the UK variant have started evading the natural immunity, from infection. And these vaccines, with these vaccines, they have more protection po, no? If and the protection is longer, much longer compared to the immunity from natural infection. So this is the human cell, no? Ito po yung mga AC receptors. And ito naman po yung mga spike protein ng SARS-CoV-2. When this virus is yung protomer na po ito is open, no? It can highly easily attach to this ACE2 receptor of the human cell. That's why it's very important that we emphasize po physical distancing, staying away from another person, avoiding gathering, yung social event that may cause super spreading event. Kasi nga po, that will increase the chance for this spike protein of the virus to get easily attached to the human cell. Especially if these proteiners nga po are open. And the most powerful antibodies bind to multiple sites in the key part of the virus. Even if a mutation affects the binding in one site of the region, let's say sa spike protein, yung antibodies naman po of the vaccine, natatarget pa rin niya yung remaining sites that would still be protective. Okay, so the current vaccines will work against the new COVID-19 variants. There is no evidence that the current vaccines will fail to protect against the COVID-19 variant detected in the UK and South Africa. And that's the reason why nga po, no, in Israel and now in US, they are going back to the new normal, no? And they need not wear masks whenever they are outdoors, no? And vaccines stimulate our immune system to produce a wide range of protective antibodies. And this antibody will kill the virus. No? Although the new variant increases transmission, there is no evidence so far that suggests that increases the severity of the disease. Unfortunately nga sa UK variant natin, nakikita na po natin that this UK variant is getting much deadlier. Extra precautions like 3Ws nga po, wearing of mask, washing your distance, and wash your hands, no? Are preventive in spreading these new variants. And the changes in the variants are not sufficient to make the vaccines ineffective. Therefore, even with the variants, go pa rin po tayo with vaccination because this is our only way out of pandemic. The SARS-CoV-2 virus is mutating and we see that 23 times na pong nag-mutate ang ating UK variant. And these viruses can only mutate when they replicate. And we have allowed them to spread and replicate like wildfire with a surge in the number of cases. Mabuti na lang po, nag-lockdown po tayo. At least we have slowed down the spread of this virus. The best way to prevent mutations is to reduce transmission. So, because this is a novel virus, there is no medicine to prevent or treat the virus. But what we are seeing po, me as an infectious disease specialist and having seen a number of cases in San Lazaro Hospital, which is an apex referral center for moderate to severe and critical cases, those who were given sa mga moderate to severe before complications set in po ng mga remdesivir and tocilizumab and probably leronlimab na rin po, they have better prognosis po, than not giving medications po, So we are seeing better prognosis, and the following day upon giving of these medications, as if parang magic, the signs and symptoms really decrease. So sana nga po ang government natin will find ways and means po para tumaas ang vaccination po natin, encouraging more people. And for those who got infected, sana there will be more medicines like the remdesivir and tocilizumab, leronlimab, which are drugs for compassionate use kasi hindi pa po talaga ito approved by the FDA. Okay? So vaccines, this would decrease the number of people susceptible to the coronavirus, and the vaccines would create a sustained firewall. So we have here po the SARS-CoV-2, the virus, and ito naman po yun sa vaccine na ang kine-create po, our body is being taught, our immune system is to produce this antibody. So this vaccine is a tiny weakened non-dangerous fragment of the organism and includes parts of the antigen. So different vaccines po, they have different delivery van. For example, yung ating AstraZeneca, ang delivery van niya na is a vector adenovirus. So doon po nilagay yung RNA and this will teach our immune system to produce the antibody. On the other hand, yun naman po mga mRNA natin like the Moderna and the Pfizer, kinuha po nitong mRNA, in other words, yung genetic code ng COVID-19. So there is no virus po that is incorporated in our body, So what is itong mRNA genetic code material po, ng mRNA is ang kanyang delivery van is a fat globule, So ito po yung lipid, nanolipid, fat that is injected into our body, and it will tell our immune system to produce the spike protein so that when our immune system recognizes it, it will create the antibody. And when the COVID-19, we are exposed to a COVID-19 disease, to the virus, our body will produce the immune system. This will kill the virus and we will not get infected. Or in case, for instance, in the case of Sinovac, in case we get infected, it will only be mild in presentation. We will not get a severe COVID. We will not be in a critical condition, and we will not die of COVID-19. So the reason we have vaccines is to prevent severe disease and death caused by infections. So kung wala po tayong vaccine, our body will not be ready. No? Wala tayong antibody na papoproduce that will kill the virus. Again, this is how the vaccine po work. Yung weaken that disease bacteria or virus is introduced in the patient often by injection. So hindi po nagko-cause ng disease ng COVID-19 ang vaccine, because for example Sinovac, ito po ay killed virus, it's a whole virus but it's a killed virus, and according to a Brazil study, among the 5 vaccines trial they made, it is Sinovac which is the safest of them all. The WBC triggered to produce antibodies to fight the disease. And if the person encounters disease later, antibodies neutralize the invading cells. So protektado po tayo at hindi po tayo magkakaroon o hindi tayo mamamatay ng COVID-19. Again, ito po yung spike protein from the SARS-CoV-2 ng virus. Ang tendency po nitong spike protein is to attach dito sa ACE2 receptors. So meron po tayong antibody produced from the back because by the immune system para po i-neutralize niya. It will serve as a barrier. Sasabihin nitong antibody, hindi ka welcome dito. So hindi siya makakapasok sa ating katawan. Okay? Again, this is the spike protein po ng SARS. This is the one that is being attached sa human cell. And this neutralizing antibody, magla-lock and key po dyan. So this virus will have no opportunity to invade our immune system. Okay. Making antibody, this antibody against the spike protein, which is responsible for binding to human cell, is very important. So to make it to understand it better, how the COVID-19 vaccine works, let's watch this.
The vaccines work by alerting your immune system to mount a response, to create antibodies that can then fight off a COVID-19 infection if it happens.
No vaccine is 100%. If you receive the vaccine, we still recommend that everyone take the same precautions as you would as though you hadn't gotten the vaccine.
We don't know if these vaccines prevent asymptomatic infection. That's where you may carry the virus and could transmit it to others without ever being sick yourself. It's also a fact that not everybody around you is going to have the opportunity to be vaccinated soon. And for this reason, it's very important that even after vaccination, we continue to mask, hand wash, and social distance.
So, there are those who are saying, lalo na po yung mga anti-vaxxers, yung mga vaccine hesitant, ayaw nila ng magpabakuna because of its accelerated development. Yung usual po na 10 to 15 years in the making ng traditional vaccine, it only took 12 to 18 months for this COVID-19 vaccination development. So it is because of the speed and the scale, transparency, funding, and global solidarity. These are the keys for the accelerated development of this COVID-19 vaccine. But there is no cutting corners. There are only overlapping of preclinical and clinical trials with scaled-up manufacturing process in parallel. Siyempre, marami pong mga bansa, maraming fundings, money are poured in. So these are the multiple magic ingredients why there is a successful COVID-19 accelerated development. Okay. Again, these are the different types of COVID-19 vaccines. Meron po tayong genetic vaccine wherein yung our immune system will be taught to produce the spike protein para po rito sa mRNA na iyan. We have the viral vectors like sa AstraZeneca, sa Sputnik, and sa Johnson's wherein this genetic code for COVID-19 is in a delivery van of a viral vector, particularly adenovirus po, no? And we also have the inactivated virus of the Sinovac and Sinopharm. Okay. So, take note po, no, na although these vaccines are not 100% protective, no, these are still suitable for people with weak immune system. Yung mRNA po natin, yung viral vectors, no, adenovirus po para po sa ating AstraZeneca, no? Sa Sinovac, yung wolf virus, and then yung protein subunits, yung Novavax. Okay? For the number of doses, these are 2 doses except po sa ating Janssen na 1 dose only. When it comes to storage, pinaka-demanding when it comes to logistics po ang Pfizer because you will need an ultra-low freezers, kailangan negative 70 degrees Celsius. Otherwise, the efficacy will be lessened po. Compared to Moderna that only entails negative 20 degrees Celsius. And they are looking forward for a Moderna which can be placed in a 2 to 8 degrees Celsius in the near future po. Okay. So, comparing the COVID vaccines, no, as summarized by Dr. Solante, when it comes to prevention of symptomatic disease, yung Pfizer, Moderna, Sputnik, Novavax, no, ito po yung matataas talaga yung efficacy. Followed by AstraZeneca in around 70%. Dito po sa Sinovac, no, different trials have different efficacy rate. Like sa Brazil trial, this is the only trial that used the healthcare workers. Ito po yung mga directly involved, yung mga frontliners who are directly involved in managing cases of COVID-19. That's why they have an efficacy of 50.4%, followed by Turkey of 91, and then sa Indonesia 65.3, and then Janssen with 66% efficacy. As for those who are seniors, no, yung Pfizer and Sputnik, they have more than 90% efficacy. Moderna has 86%. And recently, yung AstraZeneca is only considered to be efficacious for the senior citizens. And recently po, no, in our FDA in the Philippines, it already approved our Sinovac among senior citizens. And in San Lazaro Hospital, during our first rollout po, all of our, or most of our senior medical consultants opted to get themselves vaccinated for the Sinovac. For a reason, sabi nga po ni Dr. Fauci, the first vaccine available is the best vaccine. What we want is 100% protections versus the severe COVID. Better than no vaccine at all. At least by this time po, we are fully immune already. Because take note, no, except po sa Pfizer na 7 days after the second dose, meron ka ng full immunity. For all the vaccines po, no, we need to wait for the second week after the second dose of the vaccine before we can have a full protection. In between, pwede pa rin po tayong magkasakit, pwede pa rin po tayong mamatay. So do not let your guards down if you are vaccinated already. No? So for the prevention of severe COVID, and this is the best benefit that we can get, no, for the vaccine, is 100% protection. Okay? For the efficacy, and Janssen, it has 85%. No, ito po yung 1 dose ng ating vaccine. For the efficacy versus the new variants, yung Pfizer, Moderna, and also Sinovac claim to be effective versus the UK and the South African variant. Yung AstraZeneca, 74% sa UK, 10% sa South Africa. Janssen, 66% sa South African variant, and sa Novavax, 86% for UK, and 49% for South African. As to side effects, all of these may cause pain on injection site. Most common systemic side effects is fatigue and myalgia. All have mild to moderate side effects. During our vaccine rollout po in San Lazaro Hospital, we saw many side effects in AstraZeneca compared to Sinovac. And the most common side effects po are yung fever and chills and headache and body malaise. Hence, a number of our healthcare workers na applied for sick leave ng 1 to 2 days, no, when after getting the vaccination, the AstraZeneca vaccine po. Okay, and for the WHO threshold for vaccine efficacy is 50%, no? Hence, all current vaccines pass this criteria. With regards to Sinovac po, yung CoronaVac, according to Brazil trial, the 50% efficacy does not mean 50% of those who receive it will not be protected. So hindi po porque sinabi natin na 50% efficacy ay 50% ng tao hindi mapoproteksyonan. It only says that when you take the vaccine, you have 50% less chance of developing COVID-19. So better to have this Sinovac. At least you have 50% protection rather than no protection at all, no? So what we are considering here is 50% na hindi ka magkakaroon ng mild infection, okay? I mean, when it comes to efficacy, we are considering here the symptoms pertaining to mild infection. Sabi nga po natin, when it comes to severe infection, 100% po yung efficacy ng mga vaccines na ito. 78% chance of not needing any medical care. And take note, 100% chance of not needing hospitalization, of not getting severe COVID, and not dying of critical of COVID-19. When it comes to safety and efficacy, sabi nga po natin, Sinovac 50% against mild disease. Yung 50% na pinag-uusapan natin po rito is symptoms in case of mild manifestations. Okay? AstraZeneca 76 against mild disease. Sa mRNA naman po up to 95% against symptomatic disease. Okay? Pare-pareho po sila 100% for severe to critical disease. No? Except for AstraZeneca na 85% against symptomatic disease among 60 years old. Okay? When it comes to adverse events, no, in a study conducted, no serious adverse event among 700 healthcare workers more than 60 years old. Dito sa AstraZeneca, and that's the reason why nga po temporarily this has been held by the FDA. They are investigating regarding this rare clotting disorder or the vaccine-induced immune thrombotic thrombocytopenia with an incidence of 1 into 100,000 or up to 1 to 1 million. The mRNA, there's the incidence of 3 to 5 anaphylactic reaction in 1 million. That's why we are emphasizing here po that the vaccine is not 100% protective. We have to weigh the risk versus the benefits. And the best benefit of this vaccine is we will not get the severe infection. The officials, again, as I've said earlier, in Brazil say that Sinovac is the safest of 5 vaccines they are testing in phase 3 trials. What about the risk of blood clots? 4 in a million in AstraZeneca, that's 0.004. Up to 1,200 in a million when you are taking birth control pills, or up to 0.12%. For those who are smokers, 1,763 in a million, or 4.18 of smokers will get blood clot. And here, 165,000 in a million COVID infection, or you will get blood clot or embolism in around 16.5% of the cases. That's why among over our COVID-19 cases na mga severe critical, we are giving po na mga blood thinners. Okay? So, take note that the vaccine efficacy rates vary only with respect to mild forms of COVID-19 illness. Sinasabi po natin na 50% lang dito sa Sinovac, no? Ang kanyang efficacy, 70% sa AstraZeneca. But what we are talking here are only mild forms of COVID-19. Ito po yung mga flu-like illness presentations like yung cough, yung fever, yung sore throat, body malaise, no? So these are just mild forms. Okay? But when it comes to measures that really matter, ito po yung hospitalization and death, they are all functionally the same. And the best benefit of COVID-19 vaccine is protection against severe disease. Ang problem po natin is one of the problems that we have is vaccine hesitancy. And this is defined by WHO as a delay in acceptance or refusal of vaccination despite availability of a vaccination services, because there are many anti-vaxxers campaigning in multiple countries, even some denying the existence of COVID-19. And there are many disinformation, misinformations exacerbated by fears about the speed of COVID-19 vaccine development. And given the vaccine hesitancy, the creation of a herd immunity by vaccination is likely to be challenging for many countries in terms of persuading the governments and the people to use COVID-19 vaccines effectively to be able to create herd immunity that will protect us all. No? So yung naturally occurring herd immunity from infection with significant mortality rate, this may occur only with a high number of deaths. So kung maghihintay po tayo ng herd immunity from the natural way, it entails a high number of deaths. Therefore, vaccination resulting in long-lasting immunity in all populations is the most effective way to establish herd immunity. So this herd immunity, for instance, here in the Philippines, ang target po ng ating presidente, 70 million of our eligible population. So herd immunity happens when enough of population has protection against an infection, hence stopping it from spreading. Itong herd immunity po is resistance towards getting the disease. So for example, no, ito pong black dot natin is yung infected, yung blue are not vaccinated, at yung yellow naman po are vaccinated. There are two factors that will affect the herd immunity. Number one is vaccine hesitancy. Unfortunately po, the Philippines is the country with the most number of vaccine hesitants. Alam naman po natin yung Dengvaxia really brought a big change, no, when it comes to vaccination. And the other one, yung increasing reported case of the COVID variants. Okay, so without immunity, no, let's say without vaccination, or only 25% vaccinated, or only half of those are vaccinated, without immunity, infectious diseases can spread rapidly. Okay? If majority of population is immune, the disease cannot spread easily. So, yung 75% vaccinated, 90%, and 95%, no? And to get herd immunity, according to Ontario's, no, with a non-variant strain, we are looking up to 70% coverage of the population. And we would make like up to 80% with a variant strain. So, we know naman po in Israel, ito yung benchmark natin when it comes to a successful vaccine rollout, no? So, dito sa Israel, mask is no longer required outdoor. Nag-open na po, nag-reopen ang mga schools as well as yung economy, and now they can feel summer, no? Sa Israel, where majority of people are seniors, no, yung COVID-19 cases have dropped by less than 50% and hospitalization by 1/3, despite the arrival of more dangerous variants. And Israel has the highest vaccination rate in the world, with more than half of the population, more than 5 million, injected with 2 doses already. So ito naman po yung total vaccine doses per 100 people. Sabi nga po natin, leading na ang Israel with 120, no? People per 1 million, followed by United Arab Emirates, Chile, no? Okay. However, no, sa Philippines po, nahandun pa lang tayo sa 1.6%. So, way to go pa po, long way pa rin para ma-achieve natin yung dapat na, sabi natin, at least 70% of the eligible population. As of April 22, yung doses arrived 3.5. As of April 20, doses distributed more than 3 million and administered 1.6 million estimate po. Okay. So with the emergence of more COVID-19 variants that are more transmissible, a larger number of people need to be vaccinated to achieve herd immunity. No? So kailangan po nating ma-achieve ang herd immunity. Nasa 1.7 pa lang po ng total population natin ang vaccinated. No? So in order to go back to normal, people need to be vaccinated. More people need to be encouraged, no, to get themselves vaccinated. Since this is a novel virus, there are many unknowns on the COVID-19 vaccines. Number one is the effectiveness in prevention of transmission, where yung duration then and durability of vaccine immunity. May sinasabi, how long will it last? No, is this like a flu vaccine na every year kailangan po natin magpa-vaccinate? Because they are also saying na this COVID-19 may be endemic na sa atin, no? And no data yet in terms of efficacy or safety on children and pregnant women. But studies are being done now, no? Among 6 to 12 months old, mga 12 to 16 years old. Yung Pfizer can cover, no, among 16 years old po. Okay, pataas. And too few to draw conclusions regarding the efficacy in subpopulations, no, yung mga immunocompromised, mga may comorbidities, and mga HIV cases. So vaccine for victory, when it comes to COVID-19 vaccine, time is the most important factor. This is a race between the vaccine and the variants towards herd immunity. Whatever vaccine you think you might get from waiting for the best vaccine isn't worth the risk of you getting the illness, of you getting the severe and critical disease, and of you dying of COVID-19 without being vaccinated. And the best vaccine is the one that is available. So this is our data po when we did a surveillance prior to the wala pa pong vaccine na dumarating noon. Up to 41% po, no, ng 41% rather of our healthcare employees, no, would want to get vaccinated. But when the vaccine was already made available, no, yung sa first rollout po namin, ang bilis na 10 a.m. pa lang po naubos na agad ang vaccine namin. And there were still 170, no, on that first day of our rollout waiting for the first vaccine, no. So I'd like to share with you po, no, this first vaccine rollout po in San Lazaro Hospital.
Let it go. Let it roll right off your shoulder, don't you know? The hardest part is over. Let it in. Let your clarity define you in the end. We will only just remember how it feels. Our lives are made in these small hours. These little wonders, these twists and turns of fate. Time falls away, but these small hours, these remain. All of my regret will wash away somehow, but I cannot forget the way I feel right now. In these small hours, these little wonders, these twists and turns of fate, and these twists and turns of fate, time falls away. Yeah, but these small hours, these small hours still remain. Oh, they still remain. These little wonders, all these twists and turns of fate, time falls away. But these small hours, these little wonders still remain.
So, thank you for listening and good morning.
Yan. Thank you very much po, Dr. Putong, for the very comprehensive discussion. I'm sure our doubts and anxieties are wiped away with receiving the COVID-19 vaccines. Kaya tara na po, sama-sama tayo sa Bida Vaccination. And may remind everybody, if you have questions, you can type in your questions in the chat box so they can be asked later on in the open forum. Okay?
Thank you for that reminder, Ms. Vero. Let us now be familiar with the DOH vaccine program. And to discuss with us the COVID-19 vaccine program, 10 must-knows for everyone is the Division Chief of the Health Promotion Bureau of the Department of Health. Please welcome Dr. Dominic Madumba.
First of all, I would like to thank the organizers for actually inviting us here for the town hall on the COVID-19 vaccination program, and most especially and more importantly, to discuss the 10 must-knows for everyone so that we could communicate better and we could have a demand for these vaccines. So again, I am Dr. Dominic A. Madumba from the Department of Health, Health Promotion Bureau, and we will be talking about yung mga tanong ng bayan and yung mga most common questions that everyone should know so that they could avail of the vaccines and how to proceed with this program. So now let's discuss yung strategic plan for COVID-19 vaccination. Malinaw naman po ang ating layunin that it is to have safe, equitable, and cost-effective immunization for all Filipinos by 2023. Ngunit gusto ko rin pong ipagbigay diin and emphasize the many cogs of these plans are already set in motion po. Our vaccine deployment have started this first quarter and it will continue po until we reach our goal. Our mission is to actually establish a sustainable immunization program against COVID-19 and subsequently our goal to protect the public and reduce morbidity and mortality rates due to COVID-19. So let's go now to our first question. Why do we need to get vaccinated? So the COVID-19 pandemic has taken many lives and continues to put many at risk po, So it has left many Filipinos unable to provide for their families. So ano ba bang benepisyo nito? Ang mga bakunang ito po is number 1, can prevent symptomatic infection dun sa ating mild and moderate cases. And number 2, and most importantly, this can prevent the severe infection and mortality or death from COVID-19. However, like many vaccines being used the past decades po, the protective effect of our community is only maximized pag umabot po tayo ng 70% of our population gets vaccinated. So we need to remember that this is not just about getting you or your family vaccinated, but this is also about getting your barangay, your city, your community, your province up for the vaccination. So for example po, a population of your community is 100,000, we need at least 70,000 to achieve that herd immunity. So we go now to question number 2. Which vaccines will we use? So currently po, there is a limited supply of vaccines all over the world. In fact nga po, 80% of our global stocks have been bought by high-income countries already. And because no single company can provide for vaccines sa ating 110 million Filipinos, the government is in talks with 7 manufacturers. I want to tell lang po na rest assured that only vaccines that have received Philippines FDA's Emergency Use Authorization or EUA will be bought and used dati sa community at sa ating rollout. The EUA po provides the assurance that it has been thoroughly evaluated and recommended by our various independent expert panels. And also, please do not worry, COVID-19 vaccines cannot make you sick with COVID-19 because alam po naman natin na ating mga bakuna has no active component of the virus. So who are the expert groups and what do they do? So it was mentioned na ang pinaka-critical stage of the roadmap is scientific evaluation and selection of our vaccines. So kailangan po ng various groups of experts to come together to evaluate different aspects of the vaccine plan. So here, we can see that the vaccines expert panel determines if the government should allow clinical trials and also make recommendation with vaccines to purchase. While the Philippine FDA aims to answer kung safe ba at saka effective itong mga bakunang ito. Thirdly, we have the Health Technology Assessment Council, which evaluates the evidence for those undergoing clinical trials. Number 4 in our expert groups is the National Immunization Technical Advisory Group or NITAG. So this group looks at how the vaccine should be delivered to the people. And finally, we have the National Adverse Events Following Immunization Committee or the NAFIC that looks at the adverse events, so yung mga adverse side effects and investigates if they are caused by the vaccine. So this is more of an investigational group kung meron man tayong adverse effects. So paano naman yung vaccine development and approval natin? So the development stage covers the preclinical and phases 1 to 3 of our clinical trials. So let's go first to the preclinical stage. So dito, ina-evaluate yung properties and effects of the vaccine sa mga animal models in our laboratories. And if it's found acceptable in animal studies, yung candidate vaccine will move to the clinical development with increasing number of participants. So magpo-proceed na po tayo sa phase 1, wherein the safety of the vaccine will be observed at multiple doses. So this is tested to 10 to 100 subject participants. And pangalawa, if with acceptable results, it will then move to phase 2 for monitoring of safety and initial efficacy. So ito naman po will be tested to 100 to 1,000 subjects po. And in phase 3, makikita po natin dito kung efficacious ba siya at saka yung long-term safety ng bakunang tinetest po natin. So this is tested to more than 1,000 people. So during a pandemic, an assessment is made if emergency use of a vaccine is justified. So kailangan po natin masatisfy yung 2 questions. Is it safe and efficacious? And number 2, do benefits outweigh the risks? So an application and approval po for an emergency use authorization can be made in the interim data of phase 3. So kung makikita po natin na acceptable po ang evidence of safety and efficacy ng phase 3 at saka yung benefits of using the vaccine during the emergency outweighs the risk, ay pwede na po mabigyan ng EUA ng Philippine FDA. This is in contrast naman po dun sa sinasabi nating Certificate of Product Registration, which may only be granted after review of the completed data ng phase 3 clinical trials. So question number 3. Do we have to pay for anything? Is this for free? So government will provide the vaccine for free. So hindi po natin kailangan magbayad ng para kahit saan para sa mga bakunang ito. It's also worthy to note that Republic Act number 11525 states that LGUs and private companies may enter po into a tripartite agreement with the Department of Health and the National Task Force to procure po ating COVID-19 vaccines. Even then, itong mga bakunang ito should be provided for free sa mga Pilipino. So again, wala po dapat binababayad sa mga bakuna na binibigay natin. So what are the goals of prioritizing who gets the vaccine first? So let's see kung sino yung eligible population po no, for the vaccination based on our primary, secondary, and tertiary goal. Our primary goal is the maintenance no, of most critical essential services and to direct the reduction of morbidity and mortality. While our secondary goal is to substantially control yung transmission po ng sakit na ito and to also minimize the disruption of social, economic, and security functions ng ating bansa. And lastly, yung tertiary goal natin is the resumption to the near normal. With this, kailangan po natin i-match yung mga tao with our priority goal, no? So for priority eligible group A, we have the following. So for A1, we have frontline health workers in health facilities. Ito po yung mga active na mga frontline healthcare workers natin who are taking care of our COVID-19 suspects and probables. And also, susunod po dito yung ating A2, no? Yung senior citizens age 60 years old and above. After po na ating senior citizen, ay pupunta po tayo dun sa ating mga persons with comorbidities not otherwise included no, dun sa ating naunang mga grupo. Pang-apat po sa priority group A ay ang ating frontline personnel in essential sectors. No? Ito po ay both in public and private sectors. Including po dito yung mga uniform personnel natin at saka dun po sa mga sectors na ma-identify ng IATF na papasok po sa grupong ito. And fifth group po sa ating priority eligible group A are the indigent population based on the National Household Targeting System for Poverty Reduction po, no? Na hindi rin nakasama dun sa mga previous na mga grupo na nabanggit ko po. So punta naman po tayo dun sa ating priority eligible group B, no? So who are included dito sa ating group B? First, we have our teachers, no? Yung mga guro natin at saka yung mga social workers. Then we have second, the other government workers. Third, we have other essential workers. Fourth, we have the socio-demographic groups at significantly higher risk po, no, other than senior citizens for the transmission of COVID-19. So, sino yung mga ito? Ito po yung mga ating persons deprived of liberty, persons with disability, and Filipinos living in high-density areas. Fifth po sa grupo ng Group B are overseas Filipino workers, and sixth po are other remaining workforce. So kung matapos na po natin ang priority eligible group B, ay pupunta naman po tayo dun sa ating group C. So who are included sa group C? So dito po ay rest of the Filipino population na, no, na hindi nakabilang dun sa mga grupo na nabanggit ko kanina. So basically, makikita po natin sa priority group A, B, or C, lahat po ng Pilipino, all of us will be vaccinated in this vaccination program. Now let's go to question number 5. When and where will I get vaccinated? So the national government po is working in partnership no, with our local government units to get the vaccines to you. So our local government unit will arrange for the registration and scheduling of vaccination. So kailangan lang po natin maghintay for specific instructions and announcements from your local chief executives, mayors, or governors kung nandun na po kayo sa priority list at pwede na po mong bakuna sa inyong mga localities. Yung mga local government units po natin, based on the Department of Health guidance, will implement po digital and or manual master listing following the priority eligible groups. So yung iba po nating LGUs have set up an online platform for registration for vaccination. So pwede po natin i-check in the following ways to register at magpalista po para sa ating COVID-19 vaccination. So pwede pong i-access yung registration directory dito po sa link na pinapakita dito. And also, you could ask po no, sa inyong barangay or your BHWs or BHERs or even dun sa ating public information office of each locality or munisipyo or city. So DOH with the LGUs will also identify po no, yung implementing units natin dun sa ating sariling mga localities at sa kung ilan po yung mga vaccination sites na pwede natin puntahan. So magkakaroon po tayo ng sinasabi nating fixed post-vaccination strategy. So this will include medical centers, hospitals, and infirmaries, both in private and public. Also, gagamitin po natin ang ating mga rural health units at yung iba po nating facilities no, ng mga government agencies natin, katulad ng mga health facilities ng AFP, BJMP, Bucor, at DepEd. And we will also be in partnership with private clinics kung pwede po sila ma-identify as vaccination sites. So question number 6, what do I do before vaccination? So, while we wait for the vaccines to arrive, no, we need to make sure that we obtain the accurate information from the right sources, no? So, Ask only licensed medical professionals or those who are very involved in the national vaccination program so that you are correctly advised regarding COVID-19 vaccination. So we need to verify things you may have read or heard, no? It is only when we are armed with the right information that we can rightfully decide if we want to get the vaccination or not. And rest assured that our healthcare workers that you will be asking questions are very equipped, no? Kung kailangan mo ba mabigyan ng bakuna, paano ka mabibigyan ng bakuna, at bakit napakahalaga ng bakunang ito. So ano pa yung kailangan natin gawin, no, bago magbakuna? Secondly is to schedule, no, yourself for health screening and declare your complete medical history. This is very important, no, to determine which vaccines are appropriate for you. So kailangan lang po natin i-emphasize that no person will be rescheduled for vaccination without going through health screening. Okay, no? So papasukan ko lang po ng mga most common questions na natatanggap ng Department of Health. So tanong ng bayan, can a person choose the brand of vaccine that will be given to him or her? The answer po dito is no, no? The national government will vaccinate yung ating mga kababayan based sa prioritization and scheduled delivery of the vaccine. So if a certain FDA-approved brand will be delivered first, ito po yung unang ibibigay natin sa mga priority eligible groups natin. So it will be based on what supply we have and on the prioritization list. Next, tanong ng bayan, no? Can a person decline the vaccination? Ang sagot po dito, yes. Anyone can opt to decline for vaccination by signing a waiver. So this will forfeit his or her slot according to the prioritization of eligible groups, and the person shall be scheduled after all the priority population has been vaccinated. So importante po dito is to obtain, no, yung accurate information from the right sources para mabigyan po kayo ng correct advice and can make an informed decision before declining a vaccination. Third na tanong ng bayan, will a person receive the same brand for both doses? Yes po, no? The Department of Health, in coordination with the LGUs, will ensure, no, the allocation of adequate doses of the same Philippine FDA-approved vaccine brand for those getting vaccinated. So kung ano po yung bakuna natin sa una, kung ano po yung brand na nakuha natin, yun rin po yung susunod na bakuna na makukuha natin. Fourth tanong ng bayan, I previously recovered from COVID-19. Do I still need to get vaccinated? Yes, importante pa rin na mabakunahan, no? It is recommended that you get vaccinated even if you have already recovered from COVID-19. Hindi na po kailangan maghintay ng 90 days for this. Basta po stable po kayo, na kompleto niyo yung treatment niyo at wala na po kayong signs and symptoms, pwede na po magpabakuna kahit nagkaroon na ng COVID-19. Fifth tanong ng bayan, do I need to get tested before getting vaccinated? Hindi na po kailangan, no? No tests are needed before or after getting the vaccine. Now, let's go to number 7 of our must-knows, no? What do I do during vaccination? So, during the vaccination po, you need to go to your assigned vaccination site as scheduled. Kailangan po to maintain again yung ating minimum public health standards, which includes wearing of the face mask, the face shield, and staying at least 1 meter away from others. Importante rin po na mas maganda po if our vaccination sites are well ventilated at saka maganda po yung airflow. After that, we need to sign the informed consent signifying that you are, number 1, aware of the benefits and risks of the vaccine, and number 2, you are willing to get vaccinated. On the day of vaccination also, healthcare workers will monitor you po, no, for 15 to 30 minutes before you can go home for any unusual symptoms or adverse events. Hindi po agad uuwi pag nagkaroon ng bakuna, no? So, kailangan pa pong i-monitor kung may lalabas sa mga simptomas. And after this, hindi pa pababayaan ng DOH ang ating mga kababayan because all Filipinos who are vaccinated will be monitored for 12 months after they get their shot. So, in connection po dun sa sinasabi natin kanina na monitoring, adverse events following immunization will be monitored strictly by our health professionals. So, if hospitalization is needed, yung existing PhilHealth case rates po natin for AFIIs will be used. And during also the master listing and profiling, PhilHealth will provide registration desks on-site. Question number 8. So what do I do after vaccination? So usual symptoms may be experienced po, no? Including pain, redness, and swelling at injection site, as well as flu-like symptoms including fever, headache, and fatigue. So these are normal signs lang po, no, that your body is actually building up protection. But if discomfort increases after 24 hours or nagkaroon po ng unusual symptoms, no, and this is worrying you, you can always report po to the nearest health authority for appropriate management. So question number 9. After vaccination, should I still wear face mask and face shields? Ang tamang sagot po dito po ay of course yes. The COVID-19 vaccine is just an additional tool, no, to protect ourselves from this disease. Even after vaccination, we need to practice the minimum public health standards to provide po yung continued protection natin sa ating sarili, sa ating pamilya, and to our community. This way po, no, we can be safer from the threats of COVID-19 transmission and also dun sa mga nakikita po nating nagsusulputan ng mga variants. And lastly, yung question number 10 po natin, how do I ensure that the vaccines I get are authentic? So only COVID-19 vaccines with Philippine FDA certification and are transported po, no, under strict cold chain conditions are able to provide full protection for those who are vaccinated. So now that we have discussed the 10 must-knows, kailangan rin po namin ng participation po ng ating mga audience dito and our partners in the public in actually getting through the COVID-19 vaccination communication to the most people. We must be agents po, no, of tamang informasyon to share only accurate information and get posters and explainer videos dun po sa ating mga reputable institutions at dun po sa ating mga agencies who are doing fact-checking. The Department of Health is giving this link po kung gusto nyo pong i-download po yung mga materials po namin. And also to cascade yung 10 things you need to know about COVID-19 vaccines video to your networks, friends, and families. We could also take active steps po, no, to be informed and validate our information from our website. It's doh.gov.ph/vaccines, and to organize sessions or fora to engage others constructively. And also to join DOH organized or DOH partner supported webinars and trainings for more information and for updates. And we also request po, no, for the participation of everybody in involving themselves in our feedback platforms. So you could always give feedback po dun sa aming official DOH email addresses and also to disseminate and accomplish po, no, yung aming DOH online sectoral surveys that we will be disseminating from time to time. So dito po makikita namin yung pulso ng bayan, your suggestions, your comments, and what are the knowledge gaps pa po, no, na kailangan namin i-address. And finally, be champions po, no, of this vaccination program dun po sa ating expert recommended FDA approved vaccines. So be conscious po that our power is actually here. Meron po tayong leverage to change other people's opinions and to actually encourage people to get themselves protected from this COVID-19 disease. So that ends our presentation, no, and our discussion on the 10 must-knows for the COVID-19 vaccination program. It's very important that we are very knowledgeable, no, on this 10 must-knows so that we could effectively communicate with our constituents, our family members, our friends, our workmates, and kung sino pa man yung magtatanong sa atin regarding this vaccination program. So as my last message po, no, so kailangan natin rumes bakuna dahil tayo ay kasangganang bida. So this is very important to add another layer of protection, no, from mild and moderate cases of COVID-19, but most especially, no, to prevent yung ating severe and critical cases and actually pati yung death and mortality from this disease. So sa ating lahat, maraming salamat po and stay safe.
Thank you very much, Dr. Madumba, for the enlightening, encouraging, and correct information on the 10 must-knows on COVID-19 vaccine program. So, after being injected with all those valuable knowledge, there may still be lingering questions in our minds. We still have the chance to clear these questions up through our open forum, to be facilitated by the Health Education Program Officer 3 of the Department of Health, Ms. Maria Victoria Madura.
Thank you, Ma'am Beron. Good morning to the faculty and students of the De La Salle University College of St. Benil. As our hosts have mentioned, we come to the most awaited part of this town hall, the question and answer portion. We are lucky to have with us today as our panelist, Dr. Nim Paputo, Medical Specialist 4 and Head of the Public Health Unit, and Dr. Mel Anthony Aquibera, Medical Officer 4 of the DOH Health Promotion Bureau. Good morning, Dr. Nimpa and Dr. Mel.
Good morning, Ma'am Bicoy. Good morning, Dr. Mel.
Good. Okay, so we start with the first question. Our first question is from Jonathan Sale. If someone gets Sinovac from our LGU and decides to have Pfizer or Moderna later when available, what will be the minimum gap between these two vaccines? Is it possible to do so in the first place?
So, yeah. Okay. So right now there is no advisory from the Department of Health. No, although there is ongoing trials, there are ongoing trials regarding mix and match, no, of the different vaccines like yung mRNA, and then like say Moderna to AstraZeneca, no. But for now, we have to wait for the advisory from the Department of Health if we will do such in the near future.
Doc Mel, do you want to add up?
Ma'am Bicoy, sorry, it's about the mixing of vaccines, ano? Tama ba? So, medyo so right now nga, as mentioned, wala pa tayong mga enough for the mixing of the studies. But yun nga, this will be i-review yung ating mga evidences naman din po, no, para titignan yung mga ganito. Kasi right now there's paucity of data, but we need to determine this para we can give the right recommendation for our people. Thank you, Ma'am Bicoy.
Okay, thank you. For another question from Emmanuel Apable. How does the government intend to roll out vaccination for college instructors from school or LGUs? Do we fall under B1 category priority? Dr. Mel, you want to answer that?
So maraming salamat po sa tanong. Maraming salamat sa tanong. Bali, right now we are currently conducting we are currently doing vaccination na for A1 to A2 population. And the next population naman na po will be, yung guidelines po for it will be given na din naman na po once nagpo-proceed na tayo sa ating vaccination rollout. So if you are interested to be vaccinated, and we highly encourage you to be vaccinated po, you should determine kung kayo po ba ay mayroong ibang comorbidities, because if you are a teacher and you have certain comorbidities, you are part of the A3 population, no? And if you are a teacher naman and you are part of the senior, part naman po kayo ng A2. So parang ganun po, you look as well kung ano po yung iba pa ninyong mga saan pa kayo ma-part na population other than being po sa teacher po, and we highly encourage right now kasi our vaccination is ongoing sa ating mga sa mga sites po natin, sa mga LGU po natin. So if ever you coordinate po with your LGU regarding sa registration and po sa mass releasing for it. Thank you, Ma'am Bicoy.
Thank you, Doc Mel. So, Doc Timpa, if you would add, just call my attention, right? Okay. So another question from Miss Athena Tiglao. What would be the age limit for the Group C category? Who would answer this, Doc Mel or Doc Nimpa?
Doc Mel?
Doc Mel.
So right now kasi 18 years old pa lang pataas po ang ating advisable na age group, no? There are ongoing studies regarding 18 pababa, but for Pfizer, 16 years old po and above pwede na.
Okay, Doc Mel. Doc Mel, naka-mute ka. Okay. Seems like wala nang i-add up si Doc Mel. Okay, for our next question. Okay. Wait lang po. From Leo Mario Owaper, which vaccine is the best option for persons with high blood and allergies? Doc Nimpa.
Yes. As mentioned by as emphasized rather by Dr. Fauci, the best vaccine is the one available. Regardless of the brand po, our best benefit here is 100% that we will not get severe COVID and we will not die if we are vaccinated.
Okay. Thank you for that, Doc Nimpa. So another question from...
Can I add lang po, Ma'am Bicoy? Yes. For clarification lang po, no? For those that would need clearance, kasi we are hearing, no, yung mga posts sa mga Facebook, mga news regarding those na mga senior citizens and more comorbid na they were somehow associating it or targeting the vaccine as the one causing it. So it's a coincidence. We are not saying that that this is the one that really caused it. That's why there are investigations being done among those who died or got severe infection. But take note that for those who have the autoimmune disease, yung mga may HIV, yung mga may cancer, nagre-renal transplant, taking the steroids, and also yung mga bedridden with prognosis who wanted to get the vaccine, these people, this group of people would need clearance first po, prior to giving of vaccine. And yung pong may blood pressure na 180 over 120 and pataas, hindi po muna natin ipa-vaccinate sila, no? So we have to take caution among this group of people. Again, the vaccine is not 100% protective and safe po. We have to weigh the risk and the benefit.
Okay. So a follow-up question on that. Can a person take a flu shot a month before taking a COVID vaccine?
Yes, 2 weeks before, 2 weeks after giving of COVID-19 vaccine, pwede na pong magbigay ng any vaccine po. There should be a gap of 2 weeks prior to giving of other vaccines po.
Okay, so for another question from Filipinas de Guzman, what if you are taking vitamin K as supplement? Is it safe to be vaccinated with the COVID-19 vaccine? Supplement.
So, yes, earlier we have presented po the risk of 16.2, no, if you are not of getting COVID-19 from the blood clot. Okay po. So again, before you take the vaccine, for safety, no, take the INR, the PT and PTT, so yung mga bleeding parameters po, no. If there is abnormality or mataas po yung chance na mag-bleed, i-defer po na muna natin until such time that our bleeding parameters are within normal limit. So better be safe than sorry po.
Okay, another question from Lena Catalan. Are there known side effects of the vaccine when injected to person with diabetes, hypertension, or obese? Isunod ko na rin, Doc Nimpa, from Maria Lourdes Nacionales. Is the vaccine safe also for people who are allergic to certain foods and painkillers such as ibuprofen?
So those are considered as low risk po ng low risk, no. We will only observe them for 30 minutes instead of 15 minutes monitoring, and we do advise that they take the antihistamine an hour before giving of this vaccine, no. So for the in terms of sa mga side effects po, no, regarding sa alam naman po natin those with comorbidities like yung diabetes and hypertension and obese, these are high risk factors po towards severity and dying of COVID-19. So many of our, based from my experience po in San Lazaro Hospital, many of our healthcare workers are senior citizens with many comorbid illness, no. But for our senior citizens, there are lesser side effects compared to those that who belongs to a younger age group or between 20 to 40 years old. Yung mga may diabetes, yung mga may hypertension, sabi nga natin earlier, the only reason for deferral if they have poorly controlled diabetes, poorly controlled hypertension, no? And if they are not feeling well, if they have signs and symptoms of COVID-19, no? If it's already incubating, if you are a close contact, might as well defer po. So, seek consult din po, no? If there are doubts, no? You can always call us po, no? Uso na po ngayon ng telemedicine or always a town hall session like this po, no? So, for better understanding.
Okay, another question from Joanne Tandok. Is COVID vaccine safe also for a person taking immunosuppressive medications?
Yeah, for those who are actively taking immunosuppressive suppression, kailangan po talaga natin ng clearance, no? Again, we will need to weigh the risk and the benefits. Kung hindi po naman stable ang condition, better defer it until such time na okay na po ang condition natin. So you will have to take yung non-pharmaceutical way pa rin po na wash your hands, wear mask and watch your distance and avoid unnecessary travel, yung mga crowding na ganyan po if you are not yet vaccinated, especially if you are immunocompromised because you have higher chances of getting complications, of getting severe COVID-19 and of dying if you are not really vaccinated.
Okay, so another question here from Rene Arganda. Is there any reported adverse effect of vaccine to people with history of allergy to NSAID and allergic rhinitis?
Yes, we've got a number. There was one fellow and another nurse who really had a history of allergy. They took the antihistamine, they were advised. And during the vaccination, we saw these people getting the rashes, no? And they were rushed to the emergency room and given the antihistamine. And then just as a number of hours, they were back to normal. So it's part of the risk that we can experience during the vaccination.
Okay, from Ambero.
Sorry, can we make your calendar po? Kaya po, it's very important na during the vaccination, during the master lacing process, or if you have any mga allergies or any history of these kinds po, allergies of food or medication man po, you disclose this. Kasi all patients po na babakunahan ay i-obserbahan po. Lahat po yan. Kahit may allergy ka, may sakit or wala, kayo po ay obserbahan. Mandato po yan na dapat obserbahan kayo 15 minutes after mabakunahan. Pero po kung may mga certain allergies po kayo, will be observed longer po. Kasi although ang pinaka-contraindication lang natin talaga to get these vaccines is yung mga specific allergy to the product itself, kung may mga components po siya like yung PEG po natin, no? But yung mga, if you have these allergies na iba, na hindi yun sa component, but meron kayong history ng allergy, mas longer lang po kayo i-observe. So 15 to 30 minutes, i-observe po kayo. And our vaccine sites naman po are ready to administer any po na management para po if ever man these things happen. And ayun, so maliban po sa pag-obserba ng 30 minutes or longer, lahat po ng mga napakunahan ay i-observe pa. Meron tayong kailangan po mag-report kayo kung magkaroon kayo ng any symptoms. Kahit po natapos na 1 day after, 2 days after, so dapat mag-report po kayo sa isang site po kayo na para po mamonitor po yung mga sintomas po. I hope clear po yun, Ma'am Vicoy. Thank you so much.
Thank you, Doc Mel. Another question here from Miss Baron. Okay. May I please ask for cancer patient under chemo treatment, how many days or weeks can the patient be vaccinated from her chemo cycle schedule?
Better po ask clearance from your attending physician po. Yes. So it's a case-to-case basis din po talaga. Depende po sa how stable your condition really is. No? If you are feeling well, in good condition na po, you can ask clearance po and let your oncologist give the clearance for your vaccination.
Yes, they know well kung ano yung kanilang status, right? Okay, for another question, would you recommend to take paracetamol an hour before getting the vaccine, first and second dose?
Yes. Yeah. There are those who want to play safe.
Before, Doc, before ang sinasabi niya. An hour before getting
Yeah,
the vaccine.
before. Yes. 1 hour before or 1 hour after, it will not do harm. No? Pwedeng security blanket po. There is no side effect if you take such because it's a safe medicine.
Okay, thank you for that, Doc Limpa. So another question here, is it true that a person can only take the COVID-19 vaccine shot after 3 months of testing negative already? Isunod ko na rin po this question. Good morning po. When po safe magpa-vaccine pag nag-positive sa COVID-19?
Okay.
So yung isa po negative after 3 months testing.
Yes.
And then yung isa naman, kailan daw kung nag-positive naman sa COVID-19?
Okay. So we know so well po that there is really a surge, no? Particularly ng variants, ang taas ng transmissibility. So what we do, and as per advice na rin po ng Department of Health, as soon as you recover, sa amin, as soon as that the person comes back on duty, binavaccinate na po namin sila ng second dose. No? Or even for those na first dose kung wala pa talagang bakuna. Again, because this is a race between the vaccine and the virus. Better to have protection kasi we still need to wait 2 weeks after the second dose po before we can achieve the full immunity.
Okay, Doc, isunod ko this one. Sige, Doc. Sige, Doc Mel.
Sorry po. I-highlight ko lang po yung importance, no? Kasi some studies would say na even if after na you got the infection, no, got COVID infection, yung immunity response from that hindi din parang hindi siya yung parang you will get the full immunity even if you get the COVID-19 infection. So that's why it's better to take to get the vaccination, and that's the current recommendation even after na COVID po kayo, no. So and as mentioned by Dr. Nimpa, yung immunity response po kasi natin, the immune conversion after getting the first dose of the vaccine will start to develop within 2 weeks from getting the vaccine, and you will get the full immunity, no, full protection katulad sa nabanggit ko sa lecture after pa ng second dose. So even if may first dose, nag-start na po mag-produce ng immune response, pero the full protection you will get it sa second dose pa. So it's important to get yung ating the full 2 doses po kung siya ay 2-dose man na vaccine kasi meron tayong 1 dose na vaccine. Pero if it's a 2-dose vaccine, it's important to get the 2 doses po to get the full protection na discuss din po kayo ni Doktora. Thank you, Ma'am Bicoy.
Can I add to that, Ma'am Bicoy? Yeah, earlier I mentioned po during the discussion that the variants hindi lang po ang South African and P1, even the UK variant, they have the ability to evade the natural immunity post-infection. That's why we do advise po na right after makarecover, mag-vaccinate na po tayo.
Okay. So i-follow-up question na rin po from that, from Anne Kamit. Are we required to have COVID testing a few days before the vaccine?
No. It's not cost effective po. And yung kung nag-incubate po talaga, no, you can even have a false positive result, no, and a negative result doesn't rule out po. Kung kayo po ay close contact, you have an exposure of more than 15 minutes sa confirmed case po. If you have the signs and symptoms ng COVID-19, better defer po. Wag mo nang magpabakuna because it will just neutralize the antibody that will be produced. Sayang ang bakuna.
Okay, so for another question here, in comparison with other diseases, after getting the second dose, will there be a booster after a year or 2? If so, do we require the same brand of vaccine?
Sabi nga po natin, this is just a new vaccine, wala pang 1 year. There is a need for more data to investigate to how long the immunity will last. But they were saying that it will behave like the flu, flu disease na you will have to get the shot on yearly basis. And because they are saying that probably this virus will stay as endemic po, no, as the disease will stay as endemic.
Okay, so follow-up question on that. How many months or years can a person get another round of COVID vaccine?
So, sabi nga po natin, Arya, probably yearly basis po like the flu vaccine. We need to for more data po to confirm our one po. Yes.
Ma'am Vicoy, can I add po to
Yes, Doc
Dr.
Mel.
Nika? Opo, so bali, yun nga po, no, right now with the paucity of the data na meron po tayo, hindi pa po natin masagot yung mga tanong tungkol po sa booster dose. Kung ito po ba ay kailangan ng kailangan ng booster, or will it be a yearly vaccine katulad po ng flu vaccine, or booster dose na mas matagal? We don't know pa po kasi nga as mentioned, bago po yung bakuna natin, and wala pa tayong mga enough evidences to say how long po yung duration ng immunity po natin. But what is important, Ma'am, because siguro I would like to highlight lang na if the vaccine is already available and kayo po ay part na ng priority population, it's better to get na po, no, na nakita natin yung mga evidences about it, ang mga bakuna po natin ay nabigyan ng napag-aralan po siya at nabigyan ng evaluation po ng ating vaccine expert panel, at nabigyan po ng authorization ng ating FDA na masabi po natin na mag-guarantee natin na these vaccines are safe and effective po for use against, no, para maprotektahan ang sarili natin from the severe COVID. Kaya if it's available to you, kung kayo po ay part ng priority population, we highly encourage you and recommend to get the vaccine po.
Thank you, Doc Mel. So, last 3 question na daw po. So with regards to Sinovac, as per Health Secretary po sa China, they say that Sinovac is not effective for COVID. That's why they are studying daw po on combining vaccines. How true daw po ito?
Ma'am Vicoy, I think for that one po, we already issued a statement about that. I think this stems dun sa circulating post few weeks back na merong statement na nirelease. And actually, I think this was retracted by the Ministry of Health ng China, no, yung statement po na ito. But we reiterate, no, na ang mga bakuna po natin kasi na ito po ay hindi lang naman po yung ebidensya ay nanggaling sa ginawa sa China, no. Marami pa po siyang ibang area na kung saan po ginawa yung mga pag-aaral po niya, no. Meron ginawa sa Brazil, merong mga patients na inoculated din sa Indonesia, etc. po, ano. And all these evidences are tinignan po ng ating mga vaccine expert panel po para ma-recommend. And yun po, again, that post is fake news. I'm sorry, but yung circulating, I think this alludes to the reported dun sa kumakalat na Viber or message na yun, no? It's a fake news po. Yun. So we need to be very careful in this kinds of thing. We need to think kung clearly analyze, no, saan po nanggaling itong post na to, and we need to scrutinize kung totoo po ba or hindi. Thank you, Ma'am Vicoy.
Thank you, Doc
In
Mel.
addition,
Yes, Doc.
in addition po, no, there is the most recent study conducted in Chile na more than 80% po yung safety and effectiveness po ng Sinovac vaccine. So we should only be based our we only need to read po sana those that are coming from credible sources like CDC, WHO, DOH po, no. If in doubt po kasi there are so infodemics as we call it. Kung if in doubt po na lalo na nagki-create lang ng confusion and negativities po, let us just avoid reading this because it will only give us negative thoughts regarding the benefits of this vaccine. It will not help our nation towards opening our economy, opening our schools, and getting ourselves protected po.
Okay, thank you very much, Doc Nimpa. So kindly answer if we are part of B1 category, what if we are not senior, or if we do not have any comorbidity?
Thank you so much po, Ma'am Vicoy, for the question regarding sa priority population. As mentioned nga po, no, i-release po natin yung further details pa ng iba't ibang guidelines pa. Lahat po ng Pilipino mababakunahan. Yun po yung ginagarantiya po natin. Yun po ang aim natin. Lahat ng Pilipino ay mabakunahan po, mabigyan ng bakuna. We just need to prioritize lang po yung ating mga most vulnerable population and most economically at risk, yung mga ating mga frontline health workers. But that doesn't mean na hindi po kayo part ng priority population. Kasama po tayo lahat sa priority population. But yun nga lang po, the specific details will be released po once lang talaga na maayos po natin yung for the A4. Right now po kasi ang inaayos po natin na guidelines is for the A4 population, and then after that, yung next na po natin ng mga population. So specific guidelines will be released soon din po para po for this other population, priority population.
Okay, thank you, Doc Mel. For the last question, please clarify po for the sake of knowing the truth. There is video circulating in FB that after the first dose of vaccination, the immune system will be weakened and we can get easily sick, not only of COVID-19, but of other sickness. Is this true?
So no, it's very much untrue po. There is no truth behind that. It's a fake news po. Yes.
Marami po talagang fake news.
So what our immune system is doing, it's starting to produce the antibody. Again, after the second week of the second dose, we are fully protected na po. Yes. And that is the real truth regarding the vaccine and the antibody po, and the immune system.
Doc Mel?
Yes, thank you, Doc. Opo, na-debunk po natin itong mga video po na ito. You can look at the post ng mga ganito pong mga balita na nakakarating po sa atin. And we analyze this different video as part of our campaign against fake news and misinformation regarding COVID-19 vaccines. And ito po ay, as nabanggit nga po ni Doktora, fake news po ito. Hindi po totoo na papahinain po ng bakuna ang ating immune response. Actually, taliwas pa kasi mas pinapalakas po ng bakuna natin ang ating immunity laban po sa ating laban po sa COVID-19, So mas pinapalakas po ang ating resistensya nito. And as mentioned by Doktora, first dose, mag-start na din po ang ating immune response ang immune system natin na magkaroon ng immune response against COVID-19, but the full protection again, you will get the full benefit of the vaccine after getting the second dose. Again, Ma'am Vicoy, highlighting the need of getting the 2 doses of the vaccines.
Thank you, Doc Mel. So we do not have much time to answer the other questions, but rest assured that we will be giving you the copy of the presentations and the links to other information materials. And also, you can visit our DOH FB page and Viber DOH Philippines. Okay, before we end our Q&A session, I would like to ask our panelists for their messages to our participants. So, ladies first, Dr. Nimpa.
So, again, we emphasize po the variants, the vaccines, and the herd immunity. And the more people we vaccinate, and the more people we vaccinate, as many and as quickly as possible, the more we can target the herd immunity. And that is at least 70% of the eligible population. And this is only our way towards escaping or a way out of this pandemic. So get protected, get vaccinated, and stop the spread of this virus. Thank you.
Thank you, Dr. Nimpa. Dr. Mel?
Unang-una po, maraming salamat po, Ma'am Vicoy. Unang-una po, magpapasalamat lang po ako sa pag-imbita po sa atin para po mailatag natin ano po ang National Vaccination Program against COVID-19, and para po mabigay po namin sa inyo ano po ang maipaliwanag po sa inyo ano po ang scientific background or rationale po nitong ating mga bakuna, paano po siya nakakatulong na malabanan po ang COVID-19. Yung mga hindi pasensya na po at hindi namin masagot lahat ng inyong mga katanungan, pero yun po, I think, Ma'am Vico, we will be sending answers naman kung i-compile natin yung mga ibang mga questions. But it's important to talk to your healthcare provider Kung may mga iba po kayong mga alinlangan, you can talk to them para po to give you any clearance and assurance regarding your vaccination. Siguro Ma'am Vicoy, ang paulit-ulit natin na sinasabi, kaakibat ng kampanya po natin laban sa COVID-19, ang ating bida solusyon. Kailangan pa rin po natin kahit nabakunahan, magsuot ng face mask, mag-sanitize ng kamay at dumistansya po yung ating bida solusyon. Kasama po nun ang ating letter A, yung ating alamin ang tamang impormasyon. Nakita po natin during this town hall na marami po tayong nakikitang mga fake news report. So para po malaman natin kung ano po ang tamang impormasyon, tayo po ay pumunta sa credible sources. Ang DOH po, DOH website at DOH Facebook page, lagi po kami nagpo-post doon ng mga impormasyon, na tamang impormasyon tungkol po sa COVID-19 at sa COVID-19. Para lahat-lahat po tayo ay tulong-tulong na rumesbak laban po sa COVID-19. So maraming salamat po.
Thank you very much, Doc Mel. So that ends our open forum. I will now give back the Zoom room to our host. Over to you, Ma'am Baron and Sir Ferdinand.
Salamat po, Ma'am Vicoy. Naki-Ma'am Vicoy na ako. Salamat
Okay
din
lang
po.
yun.
Salamat po sa pag-asikaso ng ating open forum, and thank you very much also to Doc Nympha again for being part of the open forum, of course, and also Doc Mel for responding to our questions. I know that we had a lot of questions, but I can see in the chat box that those who posted questions are happy to hear the responses, and I also hope that our open forum was able to clarify a lot of concerns and hopefully mabawasan na yung apprehension, and this is of course our objective. And at this point, we would like to proceed to an exit poll, and again we urge everyone to participate. And earlier during the entry poll we had results, and I think I incorrectly said the highest rating. So we had earlier results to our entry poll, and if we show the exit poll question, you will see that we are actually asking you the same question. So setting aside their answers earlier, we would now like to ask you honestly, if you are to answer this question again, what would your response be? So the question again is, how likely are you to get a COVID-19 vaccine? If available, with safety and effectiveness comparable to other common vaccines and with FDA approval for public use. Again, it's asking you if you are highly likely to get a COVID-19 vaccine, not likely, or not sure if you will get one. So we'll give you over a minute to again participate in this poll, and we will see the results in a while. And of course, since this is the same question as earlier, we will also try to briefly compare how the responses now differ from the ones we got earlier.
Ayan, Sir Nan, we will see how their perspectives, sabihin na natin, medyo
completely dapat
adjusted,
kalimutan yung sagot nyo kanina. I mean, after more than an hour of information
being
shared with us,
injected with
ask your question. Answer this right now based on what you now know. And also, of course, the open forum, which help a lot. So perhaps still give a few more seconds. And of course, noticeably, yung isang option walang sumasagot. Kanina may 2%.
Talagang it really helps to clear out things, diba? To
actually,
wipe away doubts, anxieties.
We still have about a minute. Medyo ayoko naman kayo madaliin kasi baka pinag-iisipan yung mabuti ang sagot. But of course, Ayan, meron na tayong we now see the poll results of our exit 2, and we now see that the rate of those, or the number of those who says that you are highly likely to get a COVID-19 vaccine is higher than earlier by at least 7%. And again, I'm happy to see na yung isang category, yung not likely, is now 0. So some of you perhaps answered and then falls under the option not sure. So better than deciding na not likely. So I'd like to say lang that our numbers have improved if we are looking at the first option as our goal, which is of course to convince more people to
Get vaccinated.
decide to decide on getting one rather than not getting it at all. So at this point, so our numbers are pegged at 94% highly likely and the remaining 6 not sure, and there's not a single one who answered or decides not to take it. Okay.
Yes.
All right.
Ayan. So all presentations and resources will be made available in the PDF form through this link flashed in the screen and also in the Zoom chat box. And this town hall meeting is recorded, and soon it will be uploaded in the DLS CSB YouTube channel. So we will inform everyone through email of the link of the YouTube channel. So you can watch this webinar over and
Repeatedly.
over. Yes.
And you can also share it, diba?
Of course, yes. So
now you also see on the screen, and DOH, the Department of Health, is seeking our support in getting our feedback regarding this town hall meeting, and we would also see on the chat box the link to the evaluation form, and hopefully you can respond to this even after this webinar, but ideally within the day so that they immediately get our feedback.
okay. So we now come near the end of our timely and beneficial virtual town hall. At this point, let us have the Director 4 of the Health Promotion Bureau of the Department of Health, Dr. Beverly Lorraine Ho, for the closing remarks.
Magandang araw po sa inyong lahat. Thank you for joining us in today's town hall. I hope all of you learned a lot and had many of your misconceptions or clarifications answered in today's town hall. Well, alam po natin lahat na ang virus, ang COVID-19 virus ay naririyan pa rin. And with the COVID-19 virus, it means that all of us are continuously at risk for severe infection. If COVID were just ubot-sipon, regular na trangkaso, then it probably would be okay. But COVID-19 can cause severe infection wherein we need to be isolated, getting sick alone, perhaps recovering alone, or worse, dying alone. No? And it is this scary prospect that we actually don't want to happen. And the vaccines provide that hope that we can be protected from severe infection. Kaya naman kami po ay nakikiusap sa inyong lahat. Let us use the knowledge that we gain from today's town hall in order to inform our decision, but also for us to mobilize not just ourselves, but our families, our friends, our relatives, and even our co-workers to get themselves vaccinated. We need to make sure as many of us are going to be protected from this severe COVID infection. So, kami po sa DOH, we commit to making sure that we're providing adequate materials to all of you so that you get the right scientific information at the right time in order to inform your decisions or your advice to other people. To those of you listening today who are perhaps in administrative positions or in positions of power, no? We also encourage you to organize amongst your companies, your groups, and really get everyone to be up to speed about what they need to know about the COVID-19 vaccination program. Tulong-tulong po tayo lahat, and the DOH has all the necessary materials that you may need. Just access them from our publicly accessible Google link, which the organizers will share with you a little later. So, without further ado, maraming salamat po ulit sa inyong lahat, and let's all continue to stay safe and stay safer, no, with vaccination. So, res bakuna nga, sabi, kasangga ng mga bida, and the bida are us, no? The everyday workers who have to toil for our families, for our companies. But with the arrival of the vaccines, we're very much hoping that our road to better normal will be faster. So, maraming salamat po, and all take care.
Thank you very much, Dr. Ho, for that closing remarks. Of course, at this point, as we end, I'd like to express on behalf of the Faculty Association of Benilde, and of course of the whole Benildian community, we would like to thank everyone from the Department of Health, the Health Promotions Bureau, and everyone who assisted us today in this town hall meeting for your gracious sharing of this very crucial information at this point. And I'd also like to thank the Benildian community, our family, our friends, our colleagues who joined us this morning. We would be sharing and disseminating the recording and all the other links again to you so that you can freely share these among your family members and your community. So all these information are free for sharing because we all need this information. Take extra care of your health.
Okay, so nandito na po, Res Bakuna Kasangga ng Bida. Sama-sama po tayo sa Bida Vaccination, Bida Solution Plus sa COVID-19. Okay, God bless everyone. Thank you very much po.
Thank you very much, everyone. Stay safe.